Hello there. Welcome to Excel Health Arena. We have started talking about factors responsible for infertility in females. I talked about ovarian factors. I talked about tubal factors. I also started talking about uterine factors. And where I stopped on uterine factor, I was talking about uterine fibroids and uterine polyps. I said there are fibroids that will allow pregnancy to stay. There are those ones that will not allow pregnancy to stay. Then I talked about endometriosis. I said endometriosis is a condition in which the cells that line up the innermost layer of the uterus, of the womb, the type of cells that are meant to be there, those cells are growing outside the uterus instead of in the uterus. Yeah, they are growing outside the uterus, so they surround the womb. And endometriosis can also be responsible for infertility in women. If there is second-degree uterine prolapse, that is when the womb is protruding down into the vagina, there can also be infertility. Then, if there is acute retroverted uterus or retroverted womb, in this situation, the womb is tilting acutely, very sharply backward. So, in a situation like that, when there is retroverted uterus, there can be infertility in a woman. Then, let's quickly talk about cervical factors. When we talk about cervical factors are factors probably that have to do with structural defects that prevent the upward movement of sperm into the uterus, then into the tubes. So if there is any structural or anatomical defect that does not allow the cervix to do its function, the function of the cervix is to open a little bit for sperm to go in, and of course to open when the baby is to be propelled out during delivery. So if there's any defect of the cervix is the neck of the womb that leads into the vagina. If there is any defect or congenital abnormality, there can also be congenital elongation of the cervix. Cervix is just protruding, it's just very long. If there is cervical blockage, there will not be a way for sperm to find its way into the tube to fertilize an egg. So the woman will not be able to get pregnant. Then other factors are vaginal factors. Vaginal factors have to do with the vagina. There can be vaginal atresia. In vaginal atresia, the vagina is a form of structural abnormality of the vagina. So in a situation like that, the woman may not be able to get pregnant. If there is transverse vaginal septum, transverse vaginal septum divides the vagina into two transversely, that is horizontally. So it separates the vagina into upper and lower segment. In this situation, there is a block in between, and it does not allow the sperm to find its way into the uterus, then to the fallopian tube to go and fertilize the egg. Other factors could be autoimmune conditions. There are some autoimmune conditions like celiac disease. Autoimmune conditions are conditions that make the body to fight itself in a way. So it makes the body to attack itself. It makes the body to attack itself depending on where the autoimmune condition is or is affecting in the body. Then if there is kidney disease, pelvic inflammatory disease, polycystic ovarian syndrome, that affects the how the ovaries work. If there is sickle cell anemia, or in sickle cell disease, if there is thyroid disease, if a woman has undergone surgical sterilization, that is tubal ligation for family planning, she cannot get pregnant. So if there is also genetic or chromosomal disorder, any disorder of the chromosomes or genetic disorder, if there is any form of sexual dysfunction, the woman may not be able to get pregnant. So these are factors related to the 5 factors that I mentioned. The 6th factor is lifestyle and environmental factor. And with lifestyle and environmental factor, we can be talking about alcoholism, substance abuse, smoking. All these have effects on the glands that produce sex hormones. The glands that produce sex hormones, then they have effect on the quality of the egg. And in this situation, they may reduce the chances or the possibility of a woman getting pregnant. So these are factors related to female infertility, as causes of female infertility. Now, if we want to go into diagnosing female infertility, fertility testing usually involves detecting any issue that has to do with any of the processes that we have mentioned earlier. For example, number 1, pelvic examination. In pelvic examination, there is need to check for structural abnormalities. Like I said, any abnormality in the aspect of the structure or the anatomy of the reproductive system. If there's any problem identified along that path, then it will be corrected. There can also be blood tests, series of blood tests. Blood tests can be used to check the level of the hormones, if there is a hormonal imbalance as a factor responsible for infertility in women. So we can check through blood tests the level of luteinizing hormone, follicle stimulating hormone, those are estrogen, then anti-Mullerian hormone. Those are hormones relating to pregnancy and ovulation. So ovulation is also, can be confirmed. Ovulation is confirmed or can be confirmed through all these tests. So if we are able to identify if a woman is ovulating, it helps a lot. Once it is identified that this woman is ovulating and is ovulating regularly, it makes us to look into some other problems that could probably be responsible for the infertility in such a woman. Then there can be thyroid function test. Thyroid function test may be done, to check for any thyroid issue that could also affect infertility or that could affect fertility. Then transvaginal ultrasound. Transvaginal ultrasound, the ultrasound wand is inserted into the vagina to look for problems or issues with the reproductive system in the woman. Then there can also be hysteroscopy. Hysteroscopy is the viewing of the uterus. So insertion of a thin lighted tube. The tube is illuminated. So we call it hysteroscope. So hysteroscope is inserted into the vagina to examine the uterus or the womb. There can also be saline sonohysterogram. Saline sonohysterogram, it's about filling up the uterus with saline. Saline is sterile salty water. So they fill the uterus with saline and conduct a transvaginal ultrasound. There can also be X-ray of the uterus and the tubes. X-ray hysterosalpingogram. There could be sonohysterosalpingogram. That is HSG, both in ultrasound and in X-ray, to view the tubes and identify any probable blockage with the tube.